Prosthetic problems. Although we have come a long way since putting hooks on hands, there is still one major problem. That is no feelings. No, not the emotional kind, but what is obvious to everyone. The feelings of the missing appendage, which lead to multiple problems that include phantom pain and long practice times. How do we solve the number one enemy of prosthetics? We first need to solve numbness, or the lack of feeling. Now, a direct connection to the brain so that there could be a receiver, the patient's basic sensory input, telling the patient's basic sensory input. It may sound science fiction, but it's 100% real and proven successful since 2011. Implants, such as bone-in, are very permanent solutions, but also very stable, as there is no need for a socket, which could cause chafing and discomfort. And with direct connectivity to the bone, there is much more support, as much as a regular arm. It is also proven in small cases to have slight pressure feeling in the patient's hand, which may not sound like much, but could be the solution to solve the problem of phantom pain and adaptation, which is crucial. Adaptation, or how long it takes someone to get used to a prosthetic, can be greatly enhanced by the feeling of touch. It is something we take for granted. I'll give a little exercise. Get anything, empty water, a pencil, or your mouse. Put it in front of you so you know exactly where it is. Close your eyes and grab it. It's pretty easy. Now, try the same thing through thick gloves, or better yet, with a pair of tongs. It is quite the impossible task, yes, but with at least a mild sense of feeling in the prosthetic, it can make adaptation much, much easier. In most cases, it takes up to a year or more, depending on the person and the prosthetic, and difficulty of morale as a patient as they may give up. It can also give them a greater sense of self-reliance earlier on. And for you business majors out there, it does have a monetary benefit of the physical therapy facilities needing less time to be used, saving money. The most serious side effect, known as phantom pain, after an amputation, the pain can sometimes linger or feel like the original injury that caused the amputation has come back. This can affect up to 50 to 80% of amputees, and it repeats over, and over, and over again. It has been shown in a few case studies where they have had feeling reapplied through their prosthetics. They have had less phantom pain, or it has stopped completely. It is quite the simple solution to a problem. If nerve endings feel something, anything, even slightly, the brain will not react to the lack of sense and send pain signals. In conclusion, I personally think implants, through the skeletal attachments, would be the best answer for the number one barrier for prosthetics and amputees, the lack of feeling or numbness, which does solve the problem of phantom pain and adaptation and self-reliance, as a patient can get back to their lives and feel less like a burden, helping them get through an already harrowing experience of losing a limb.